Conference speech. Greetings, social work colleagues and professionals, and welcome to our annual NASW conference. My name is Ariana Jones, and I will be re-examining theoretical foundations that lay the groundwork for social work practice. During this speech, I will be discussing the psychosocial theory, the psychoanalytic theory, Piaget's cognitive development theory, and Vygotsky's cognitive development theory. How are theories relevant to social work practice? Esteemed colleagues and professionals, I am very confident you all are very aware of the importance of theories in relation to social work practice. But for the sake of this speech, I will just inform you all again. Theories serve as the foundations to social work practice, and they help us find treatment plans most suitable to whatever particular client we are dealing with. Theories help us social workers remain competent by explicitly explaining human behavior so that we can help the client without having to try too much trial and error. So the first two theories I will be discussing will be the psychosocial theory versus the psychoanalytic theory. So the psychoanalytic theory it's also called the psychosexual theory. So you may hear me bounce from those two names. So the psychosocial theory was created by Erik Erikson, and it provides a framework for human development. 6 concepts important to this theory are importance of development stages for optimum growth, development tasks, psychosocial crises, central process for resolving these psychosocial crises, radius of significant relationships, and coping. So the psychoanalytic theory or the psychosexual theory was created by Sigmund Freud, and it also focuses on human development. So 5 important concepts of this theory is duality of motivation and behavior, domains of consciousness, structure of personality, psychosexual development, and defense mechanisms. So some similarities and differences of these two theories. We have one similarity, and that is that they both are stage theories. So the psychosocial theory uses stages to explain life stages, and the psychosexual theory uses stages to explain psychosexual stages one experiences from infancy to adolescence. So some differences are the psychosocial theory examines how all the systems impact the impact experiences, while the psychoanalytic theory just focuses on mainly the psychological system and how it impacts the experiences that we have. Also, the psychosocial theory focuses on the whole lifespan, while the psychosexual theory just focuses on adolescence. So psychosocial theory and psychoanalytic theory in practice. So how can we use these two theories in practice? So the psychosocial theory could be used in counseling to interpret how systems impact the client, and what methods, those could be coping methods or central processes for resolving crisis methods, etc., could be used to help the client. And the psychoanalytic theory could be used in counseling to help those suffering with personality disorders find treatment. So now we have 2 cognitive development theories, and that is Piaget's cognitive development theory versus Vygotsky's cognitive development theory. So Piaget's cognitive development theory was, of course, created by John Piaget, and it helps describe the path of cognition we experience from in infancy and the ties of these relationships in adolescence. So important concepts of this theory is that the path of cognition is broken down into 4 stages, and those stages include the sensory motor intelligence stage, the pre-operational thought stage, concrete operational thought stage, and formal operational thought stage. So Vygotsky's cognitive development theory was, of course, created by Vygotsky, and it focuses more on the social context of cognitive learning, and highlights the importance of thought that occurred during childhood. So 4 concepts within this theory are culture as a mediator of cognitive structuring, movement from intermental to intramental, inner speech, and zone of proximal development. Okay, some similarities and differences of these two theories. So a similarity would be that both theories provide us insight on how development of cognition and learning in children and adolescents progress. So a difference would be that Piaget's theory focuses more on how discrepancies promote logical thinking while learning, and Vygotsky's theory focuses more on the social context of how we learn. So how can we use these two theories in practice? So we could use Piaget's theory to counsel children that, may suffer with cognitive disorders. And we could use Vygotsky's theory to address the stigma that all cognitive development is the same. Because this theory proves that it's not. It has a social context that is important to development. So, just as quickly as my speech has started, it's coming to an end. Colleagues and professionals, it has been my pleasure to give speech on some of the founders of social work practice. I hope I have given these people justice and that, you all take something away from what I've said. Thank you for having me, and y'all drive safe.